This is a shocking statistic. Suicide now the second leading cause of death for teenagers. Experts are urging pediatricians to watch out for warning signs and identify patients who may be at risk. Dr. Mallika Marshall has the details on some new guidelines.
Tessa is a volunteer counselor at Crisis Text Line. She answers texts from teens who are often struggling with depression or suicidal thoughts.
When they text in, it could be something like, "I want to die." It could be that simple. Or they could say, "I feel like giving up."
She's one of 1,500 counselors at the 24/7 support hotline.
It's definitely hard for these kids when they don't feel like they know where to turn to.
Suicide has risen to the second leading cause of death for adolescents. Now the American Academy of Pediatrics is urging doctors to screen patients for suicidal thoughts and risk factors, including family history of suicide, mood disorders, questioning sexual orientation, and history of physical or sexual abuse.
We can catch these kids before they do something tragic to themselves.
Too much time on the internet is also linked to depression and suicidal thoughts. Experts say pediatricians should ask if teens have been bullied online or face-to-face.
There's definitely a higher incidence in kids who think about hurting themselves or even completing a suicide in those who've been bullied.
Crisis Text Line is reaching teens all across the country. In the last 3 years, the hotline has exchanged 19 million messages. Now, Crisis Text Line says 80% of their clients are younger than the age of 25. If you'd like more information about their service, you can go to our website at cbsboston.com. And we include the number that you can use to text a message if you feel like you're in crisis.
19 million messages. I mean, thank goodness they're out there, but it's just so sad when you think about how many kids are potentially in crisis.
I know. And you have a teenager, and I have a tween who's getting there. And so, you know, we got to think about that. And it's important for parents to identify risk factors in their kids and to take them to the pediatrician if they're concerned.
Yep, definitely. Doctor, thank you.
You're welcome.
David?